Welcome to the LDN radio show, brought to you by the LDN Research Trust. I'm your host, Linda Elsiegood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. Strive Pharmacy are flipping the script with personal medicine. The human element is their crux and catalyst driving all that they do, whether interacting with patients, providers or practices. They are more than a compounding pharmacy. They're on a mission to positively disrupt healthcare as we know it. Today I'd like to welcome our guest, pharmacist Dr. Megan Kilkeary. Thank you for joining us today, Megan.
Thank you for having me, Linda. I'm happy to be here with you.
So, can you give our audience an overview of who you are and what you do?
Yeah, absolutely. So my name's Megan Kilkeary. I am a pharmacist. I have been a pharmacist for almost 20 years. Over 16 of those I have been compounding. And I have just truly fallen in love with the world of compounding. And certainly within the compounding realm, low-dose naltrexone is just a huge part of what we do. So our pharmacy, we are licensed throughout the country, and we have locations throughout the country. And we love to partner with groups like the Low-Dose Naltrexone Research Trust and Linda to provide information to providers and patients on this amazing, amazing drug.
Let's talk a little bit about the pharmacy.
Sure. So we have been around for quite some time now, compounding LDN. I'm very proud of our product that we have developed. It's a low-dose naltrexone in a tablet form. We compound it in all different strengths, but primarily the 4.5 is the most popular, as that's what most patients titrate up to. We have a tablet that is easily quartered that allows for easy titration. So that way patients can start out taking a quarter of a tablet and then work up to a half a tablet, 3/4, and then the full tablet. Our tablets are very clean. We only use the naltrexone and then a prebiotic filler within those tablets. And we do send our tablets off for potency testing prior to dispensing them to patients. And that's another thing I'm very proud of, so that when our patients get the medication, they can be confident that they are getting naltrexone in a 4.5 milligram dose. And, I think that's very important when we're talking about the patient populations that we're dealing with here with naltrexone, with autoimmune conditions, inflammatory type conditions. So it's just very important to make sure that the source of your medication is of the highest quality.
Do you do other forms of LDN?
We do. We do offer microdosing of the LDN in a liquid form. We have found, and the research has shown, especially for patients who are looking to wean off of opioid therapy or may have issues with certain type of addictions, that microdosing of the low-dose naltrexone is best for them. And when we're talking about microdosing, that's going to be in doses of 1 microgram or less in some instances. So significantly less than the 4.5 milligram standard that you generally see with the low-dose naltrexone. So for those patients, we do offer a liquid form for them. It does make the titration easier for dosage adjustments. So liquids are available. And I have also done naltrexone topically. There's a lot of great research out there that shows its benefits in certain skin conditions, psoriasis, eczema. There's a lot of really good data and research out there. So another form that we like to do our naltrexone into.
What about cream? Do you do a cream as well?
Yes, yes. The cream, I've done naltrexone cream by itself. I've also compounded it with other ingredients. Sometimes the physicians like to do a small course of steroids for the patients. So we'll put a little bit of a steroid in with the naltrexone cream to help calm down some inflammation for them. And then after maybe a few weeks on the steroid, they can transition over to just a naltrexone cream. For the cream, I generally recommend that more for topical usage if there's an issue with the skin. If you're trying to get what we call systemic blood levels of the naltrexone, I don't usually like to go the cream route. We're not sure. We haven't seen a lot of evidence that you can just use the cream to boost those levels. So if you're really looking to increase your systemic levels within your body, then the oral form of the low dose naltrexone is the way to go.
And what about sublingual?
Sublingual is a great option too. So sublingual bypasses what we call first pass metabolism through the liver. So every medication that we take orally has to be broken down by our liver before it gets disseminated into our bloodstream. So the nice thing about a sublingual dosage form is that metabolism doesn't happen. So a lot of times the body will have more available medication for it to use since it's not being metabolized. So with the sublingual dosage forms, you just put it under your tongue or in between your cheek and your gum, and you just let it dissolve over about 30 seconds to a minute. I caution patients, try not to swallow it. You want to try to let it absorb in as much as possible, and then not to eat or drink anything 15 minutes before or after using the sublingual dosage form of it. But again, another great option.
Dr. Jill Smith, I believe it's in 2010, when she did her Crohn's study.
Mm-hmm.
Up until then, we were told absolutely not to use steroids with LDN back then. So that just blew that out of the water because these Crohn's patients were using steroids. And she also used it sublingually because they had GI issues. That was quite interesting. So can you tell me about those people that think it's a cheaper option to actually make their own LDN? What are the risks and the dangers of doing that?
Sure, absolutely. So we know naltrexone was first available in a 50 milligram tablet. And that came out, I believe, in the 1980s, early 1980s, that form became available. So what sometimes physicians will instruct patients to do is to take that 50 milligram tablet, crush it down, mix it with water, and then take a small volume of that liquid to basically almost a tenth of that to try and get more of the low dose naltrexone 4.5 milligram dose. That is definitely not something that we recommend. Accuracy is of the utmost importance when dosing medications. And so using that larger strength tablet and trying to dilute it down and take a small bit of that is not ideal. A couple other considerations to think about too with those 50 milligram tablets are that they do have a substantial amount of fillers and other ingredients in there. And sometimes those ingredients can be inflammatory to our patients that have autoimmune diseases or other inflammatory type conditions. Some of the fillers can include lactose, magnesium stearate. Some of those products can have corn derivatives in them, different dyes and preservatives. And these are all ingredients that could potentially trigger an inflammatory reaction into the patient population that's already sensitive and in need of the low dose naltrexone. So that is not the ideal way to dose it. And so going through a compounding pharmacy that is able to make it into the appropriate strength is the way to go. What patient population do you have in your pharmacy? You name it, we have it. I have worked with autism specialists, Lyme disease specialists, GI specialists, addiction specialists. So it has really run the gamut over my 16 years in compounding practice. I've really seen naltrexone utilized for just about every condition, and successfully too, I would add. And one of the interesting things that we're seeing now with the explosion of the weight loss medications, the GLP-1 receptor agonists, are people combining the low dose naltrexone along with those weight management medications. And I do love that idea, because a lot of these patients have metabolic syndrome to begin with. Their weight issues were a result of maybe inflammatory type conditions that they have been battling for most of their lives. And so, I think that the low dose naltrexone, it works in a different mechanism than the weight loss medications, but it works synergistically. I think it has such a great added benefit. So I do like the potential for adding low dose naltrexone on with those GLP-1 receptor agonists, again, to help combat the inflammatory conditions that a lot of these patients have, the metabolic dysfunction that these patients have. So I think there's a huge potential there.
Do you have any case studies you could share with us?
So probably my favorite case, that I met a woman at the beach, and our children were playing together, and we just started talking to each other, and she told me she was a nurse, and I told her I was a pharmacist, and she said, "Oh, where do you work?" And I told her I was a compounding pharmacist, and she said, "Oh, I'm on low dose naltrexone." And I said, "Really?" I said, "Do you mind me asking what you take it for?" And she said, "Well, my mother passed away from MS. And 5 years ago, I was diagnosed with it." And she said she didn't really have many symptoms yet, but being a nurse, she had done her research, and she was looking at different things that she could start doing, lifestyle changes that she could start making. And she said she decided to start low dose naltrexone. And in the 5 years that she had been taking it, she had had no symptom progression of her MS. And she told me that she will not leave the house without her LDN. And once she starts to get down to the end of her fill, she said she almost starts going into a panic, because she just really feels like it has made such a huge difference for her. And so I love when people share these type stories with you. That was probably one of the most powerful ones that I had heard, especially with someone who had a family member pass away from it. And then just the thoughts of, what her trajectory potentially looked like with having been diagnosed with MS also. So that was a special story to hear.
And what about, you were talking about the ultra low dose, weaning people off of opioids. Have you had success with that in the pharmacy?
We have. There is a practice specifically that we have been working with. She is an addiction specialist, and she just sings the praises of LDN and what it has done for her patients. So she starts them at the microdosing, at the ultra low dose, as she's weaning them off of the opioids, and then she starts to work them up from the microdosing up to the higher doses, 1.5, 3, and sometimes up to 4.5. And she has been doing this for several years and has just shared with us what a huge impact it has made for her patients. I can think of another clinic that we work with that is a fertility clinic. And this physician puts every patient that walks into his clinic on LDN, and has just seen such benefit from it. And again, it's such I have people come up to me and they're like, "Well, do you think I should try LDN?" And, I say to them, I think it's a wonder drug. I love LDN. And I think the potential uses for it are endless. And I love all of the research that is coming out. The LDN Research Trust is such a wonderful source of information for providers and patients. And the books that you have put out, Linda, are just fabulous. We have patients come in all the time and ask us, well, where can I find more information? And it's just such a blessing to have the LDN Research Trust to steer them to. I think being in pharmacy, we're a unique profession. We are the only healthcare professionals that patients can come to and get advice immediately. They don't have to make an appointment to see us. They don't. As such, it's important to have quality research and quality information to have to provide those patients and physicians. So we're very grateful for what you do.
Oh, thank you. Talking about MS, like you say, I have MS, and I had a young girl who phoned me who'd just been diagnosed with MS, and she asked me so many questions, and she said, I think it's something that would help me. So I told her where to get the information from to take to her doctor, and she said, oh, but I won't take it now. I'll wait until I feel I need to. So I was trying to say, but if you take it now before you get any of these symptoms, you may not get them. Right. But she didn't want to do that. She wanted to wait until she'd got the symptoms and then take it.
Oh gosh.
If only I'd have known about LDN before I got sick, that would have been amazing.
Absolutely. And wellness and longevity are near and dear to my heart too. Those are areas of interest that I have. And, I think LDN has such a huge capacity to help us in wellness and longevity. And the studies just continue to come out year after year. And I really feel like LDN is the foundation of any healthy lifestyle. We all have inflammation from what we eat, from the environments that we live in, from autoimmune conditions that we have, or inflammatory conditions that are maybe genetically related and outside of our control. And LDN is just can help so many people across the board with those things. So yeah, I would always encourage someone, don't wait, start now.
With Western medicine, a lot of the times we see that it's the symptoms that are being treated. Fibromyalgia always springs to mind, how these people have been given multiple different medications for different symptoms other than the pain. But then they get a side effect, but the doctor says that's okay because I can give you another medication which then combats those side effects. And so the cocktail of drugs carry on until they're probably taking 3 that they're only taking because of the side effects of all the drugs that they're taking. And it's quite amazing when people with fibromyalgia start LDN, they can be on 15, 20 different drugs. And you have to remember that LDN is still a drug, and fibromyalgia patients and those with chronic fatigue are usually ultra sensitive to drugs, and it could be LDN as well. So they normally start at like 0.5 and titrate up. But once they start doing that, they're able to start reducing some of the medications they're taking. And quite often that 14 to 20 could end up being just 3 or 5. So that has to be better for your system, your organs and everything, doesn't it?
Absolutely. I remember when I was working in a hospital, and it was an acute care hospital, and the average patient that came into us was on 25 medications. And I just thought to myself, something has to change. We have to do better in our healthcare system. This can't be where we all end up down the road, is in a hospital, just on medication after medication. And like you were saying, one medication causes a side effect, so you add on another medication. And, what that does to our bodies is just we're tearing them down. And so I think anything that we can do to reverse course here is important. And that's why I truly feel that low dose naltrexone LDN is really just the foundation to good health, to help reverse some of these trends that we're seeing in healthcare of overutilization of medications.
Mm-hmm. And also talking about good health, if you sit on the couch all day eating, we would call crisps, you call them chips, or having fast food, not exercising, you're going to put on weight. And even taking LDN isn't going to work as effectively for you if you don't work on your health yourself. I mean, exercise is important, sleep is important, what you eat is important. And although LDN brings down the inflammation in the body, you can also have an inflammatory diet, anti-inflammatory diet, not an inflammatory. But there are things you can do, aren't there, as well, which aren't medication related. It's just, like you were saying, well-being.
Absolutely, healthy lifestyle. You know, I've read some articles, especially in patients with Hashimoto's, that using vitamin D supplementation along with low dose naltrexone really helps to calm the autoimmune response that's going on in these patients, and that often they can decrease their thyroid medication. They have a lot of their symptoms resolve. So as you're saying, you know, choosing that healthy lifestyle and incorporating other supplements in that work synergistically with the LDN. And we know a good high quality CBD is another one of those products that used with LDN can really have a lot of benefit for patients.
I put on, in 2.5 years, about 50 pounds or something, because I had 3 lots of intravenous steroids. So I just blew up. And then, surprise, surprise, I was then a type 2 diabetic. So then I had to take metformin, and I was really annoyed about that. And it was a job to lose that weight. I mean, it was unbelievable. Changing my diet, and I didn't really eat a lot of sugar anyway. I'm a savoury person rather than a sweet person. But I went gluten-free and dairy-free, and I managed to then move from being a full diabetic, type 2, to a pre-diabetic. So my sugar levels are really, really good. They're higher than a normal person who doesn't have diabetes, but it is pre-diabetic, and I don't need the metformin. But I have met so many people who have managed with LDN, who have changed their diet to also gone from a type 2 to a pre-diabetic. So it is possible to reverse type 2 diabetes. It's not the end of the world if you've got an autoimmune disease and have been diagnosed with type 2. There is hope that you can actually reverse it.
Yeah, absolutely. And like you were saying, just making all of the right lifestyle choices and changes, and then incorporating some good supplements along with the LDN can just really go a long way into, you know, switching over from our sick care model that's our healthcare system right now over to more of a wellness care model.
I met a doctor whose wife and daughter both had MS. You know, they were quite unwell at this point. And the doctor said to me, after he heard me talking, he said, I'm a type 1 diabetic, and I have neuropathy in my feet. He said it's really painful. And he started on LDN, and for the first time in like 20 years, he didn't have this pain in his feet, and he could walk easily. But it hadn't occurred to him when his wife and daughter were taking LDN that, hey, perhaps I should be taking it too.
For him to take it too, right? Yeah. That's right. You know, I can't tell you how many patients that I've had that have started LDN. And sometimes it was just more, not necessarily for any condition, but they see functional medicine specialists who had recommended they take it just for overall good health and to help combat any inflammation going on. And so they took it for a few months and their prescription ran out. And then they're like, oh, I don't think it was doing anything. I'm not going to get it refilled. And they'll come back to me a few weeks later and they'll say, can you call my doctor and get that refill for me? I can't live without this. And you know, we'll laugh and they'll say, I didn't think it was doing anything for me until I stopped taking it. And then I realized how much better I actually felt while I was on it. And I can't tell you how many times that has happened over the years. And again, I think that's just such a testament to what this does. You know, I tell patients, you might not always feel the benefits of it, but when you stop taking it, then you might start to realize. So,
well, I have been on LDN 21 years. 2 days ago, on the 3rd of December, was my anniversary. And my quality of life when I started LDN was 0 to a 1. It was no more than that. I dare not take LDN because I do not want to be that person again. So come hell or high water, I would get LDN somehow. To me, it's just been, I don't like using the word a miracle, but it has totally transformed me.
Life-changing.
Mm-hmm. Definitely.
Yeah.
Definitely. Yeah. So before we go, what little pearls can you leave us with?
Well, again, you know, I would just encourage anyone who might be on the fence about starting LDN to start that conversation with your doctor. And if you're unsure how to do that, go to the LDN Research Trust. There's fantastic information on there. Get one of the 3 books that Linda has written, and educate yourself and educate physicians. You know, that's I feel like that's my biggest role as a healthcare professional in the pharmacy field is to help educate people out there and learn about it and get information about it and talk to your doctor about it. And let's spread the word about what this can do. So again, Linda, thank you so much for having me on today. It's really been a pleasure to speak with you and get to know you.
Well, thank you very much. So this was Megan, who was from Strive Pharmacy. So thank you very much, Megan.
Thanks, Linda.
Strive Pharmacy are flipping the script with personal medicine. The human element is their crux and catalyst driving all that they do, whether interacting with patients, providers or practices. They are more than a compounding pharmacy. They're on a mission to positively disrupt healthcare as we know it. Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.